Weeks 15 to 20, or the early second trimester, can be one of the most exciting times of the whole pregnancy. Let's go over the different things that are happening in these visits and what else you're going to see during this time. This is the Expecting series. We're looking to give good information out there to all partners so that they can be the supportive loved one they want to be. Here at the New School OBGYN, it matters where you get your information, so please always check and vet your information, where you're getting it from. With that being said, my name is Eric Schmidt. I'm a board-certified OBGYN. Congratulations, you made it through the first trimester. It can be an exciting time, but it also can be a draining time, a very difficult time in a number of different ways. We talked about a lot of different topics already when it comes to the first trimester. We'll continue to touch on different things that are relevant to the first trimester, but now we're going to move on to the second trimester. If you want to view those previous episodes to catch up, please go ahead and do so. And we're concentrating on the time about 15 weeks when the second trimester is starting, up into 20 weeks when someone's usually getting that detailed anatomy ultrasound of their baby. So here's what to expect during that time. When you have your first visit in the early second trimester, you'll probably be asked about what's called an AFP level. Now, this is a maternal blood draw looking for a protein called alpha-fetoprotein in mom's circulation that sometimes can be elevated if baby has any concerns for potential incomplete spinal closure or what's called spina bifida or anencephaly. And so if you remember the previous episodes, we talked about prenatal vitamins and folic acid and folate and why it's so important. Well, we're basically taking it for this reason. We're now trying to detect to see if baby has an increased chance of spina bifida or anencephaly or related conditions. It is pretty rare to get a positive test when it comes to the AFP level. And so if there is a positive test, your provider will talk to you because they're probably going to want to do the next detailed ultrasound sooner because they're going to want to take a very close look at baby's spinal canal and to make sure that there's complete closure and no increased risk for spina bifida. There can be false positives of this test, and so that's why we again use this blood test and ultrasound to completely, hopefully, rule out those spina bifida or similar conditions. Okay, transitioning over to your first big detailed ultrasound. We often call this the anatomy ultrasound because we're taking a very close look at both the fetus or baby's structures, but also placenta and also mom's structures to make sure everything is going as expected. Again, this is an exciting time because this is the most detailed ultrasound usually somebody will get. And it's looking through all the different parts of baby, whether that's the brain, the heart, the different growing structures, the bones, and so everything is looked at in this ultrasound. And it's an exciting time because you're really starting to see those characteristics that we all know and love, and so you're probably going to get some really good pictures at this visit. It could even be potentially the last ultrasound you have in the pregnancy if the pregnancy continues to be low risk, and we're all hoping for a really good ultrasound with no abnormalities. However, I do want to spend a little time talking about a point which does often cause some anxiety and stress over certain findings we might see on ultrasound that are actually pretty normal. There can be some slight variations that we detect on ultrasound, whether or not this is a spot in the heart or a spot in the bowels or a spot in the brain that, if by itself, is essentially normal, but we call these things soft markers. In certain conditions like aneuploidies, or what is better known as something like Down syndrome or trisomy 21, there can be certain markers which you're seeing a slight variation in the heart and also a slight variation in the bowel, a slight variation in the size of the bones. And so all those together increases suspicion that ultrasound is showing that maybe the pregnancy has potentially a risk for Down syndrome or another similar type aneuploidy. But often we can see these soft markers or variations all by themselves, meaning we just see a spot in the heart and everything looks perfectly normal, or we just see a spot in the intestines or the brain and nothing else is wrong, or the kidneys. But it can be stressful to look on your ultrasound report or have your doctor talk to you about this and not worry. So generally, even with just one slight variation, we want to follow that up by making sure we did the genetic screening that was done before, or we might offer it at that time with that test we call the cell-free DNA. Just reassuring ourselves that this is just a slight variation of normal and there's absolutely nothing to worry about. And if you've gone through all that, you've done that, I hope you can feel rest assured that your baby is developing normally and this is essentially a normal ultrasound. Because potentially the EIF that we talked about or the echogenic intracardiac focus is seen in potentially up to 5% of ultrasounds. The next thing that we'll look at is the placenta, because where the placenta is sometimes matters. And so if it's close to or covering the cervix or the opening of the uterus where baby's eventually going to come out, we really have to pay attention to that. And that's super important. And also we want to just make sure overall the placenta looks normal, as well as the umbilical cord. And I think we might talk about these abnormalities that can arise, such as placenta previa or low-lying placenta, more in potential upcoming episodes. We're also taking a close look at the cervix and the uterus to make sure everything else is normal. Potentially someone had an ovarian cyst in their first ultrasound. We might follow up on that. Or potentially somebody has a fibroid on their first ultrasound. We'll follow up on that too. And also we pay a close attention to the length of your cervix. And why we care about this is because if it's short or the cervical length is short, that person might have an increased risk of potential preterm labor down the road. Could be certain interventions we could do to help reduce that preterm labor. Likely talk about this more in detail in a future episode. And briefly, I'll just touch on one other thing that we might do during this time in the pregnancy, the 15 to 20 weeks, is if somebody hasn't had genetic screening done at this time, you'd be eligible for the second trimester genetic screening option, which is a blood test, or you could still do the cell-free DNA if by chance you didn't get care in the first trimester. You still have options. Once again, thank you everybody for watching and viewing. It means a lot to us here at the New School OBGYN. If you learned something or you liked the video, go ahead, share it with somebody so hopefully they can have some good information too. I hope you all have a great rest of your day, and I hope you enjoy this time in the pregnancy.